Smile. Hello everyone. So in this video, I am going to share with you about peptic ulcer, which includes gastric ulcer and duodenal ulcer. That is, gastric ulcer means ulcer in the stomach, and duodenal ulcer in the duodenum part of small intestine. How to diagnose with the symptoms, and how can we treat through the our Sujok treatment. This I am going to discuss with you, and few more diseases also I will discuss with you about stomach. Okay, and let me share with you the notes which you can refer. So peptic ulcer, since I have discussed with you the structure of digestive tract, in that tract we know that the innermost structure is the mucosa layer, and the ulcer is any sore or lesion in the mucous membrane. Okay, and this can be of gastric ulcer and duodenal ulcer. So how can we understand whether the patient is suffering from gastric ulcer and duodenal ulcer? It is actually confirmed through endoscopy, but we can understand it through the symptoms also. Okay, so that we are going to discuss. Now it is more common in male than female, but nowadays it is not like that, because male sometimes, because of stress and wrong lifestyle, alcohol, smoking, like that, it is a major cause of this gastric ulcer. So males suffers from gastric ulcers mainly, and it is less common than duodenal ulcer, and sometimes females having this kind of pain during menopause, but that is not important. Ulcers are generally found in the homo area, because homo disease try to stay in the homo area. So cancer, ulcers, we will always find in the homo area as per the triorigin, and as per the sixth key, you will find in coldness area. So in the stomach, you will find the ulcer mainly in the coldness region or the homo area. And if you talk about the pathophysiology, then one of the major cause for this ulcer is the H. pylori bacteria infection, and this infection is caused because of weak immune system. And if you talk about from the 60 point of view, then the stomach comes under internal heat chakra as per the lunar system. So if your internal heat chakra is weak, then the immune system goes down, the HCl secretion goes down, and this put us in a risk of infectious disease. So H. pylori bacteria infection also cause ulceration. And another cause can be excessive acid secretion. See, because this excessive acid secretion can damage the mucosal layer. So excessive acid secretion is also very bad for this ulcer disease. So let's discuss first about gastric ulcer, and then we will discuss about duodenal ulcer. So gastric ulcers, the common cause is the disruption in the mucous barrier, and it can be due to drugs, some say painkillers and steroids. These kind of drugs can damage the mucosa membrane. Alcohol, tobacco can also disturb, and normal to low acid level is also the cause, and hyperacidity is also the cause. So normal low acid level can cause the infectious H. pylori bacteria infection, that can be the cause of ulcer, and hyperacidity can disturb the mucous membrane, that can be also the cause of the ulcer. And mucous membrane, the damage to the mucous barrier may be due to the alcohol, drugs, or any kind of things. It can be the reason. And pathological changes common along the lesser curvature or pyloric antrum. So lesser curvature is the homo area in the stomach. So it is very common in the lesser curvature or pyloric antrum. If you divide the stomach into the six key, then the pyloric part comes under the coldness, whether it is progressive circulation or spin circulation, both way, that we have discussed in 62. So both way, pyloric part comes under coldness area. So the mainly ulcer will find in the lesser curvature and pyloric part. Okay, and the histological findings will be confirmed through only through endoscopy, but we advise endoscopy later on. Generally, we can distinguish this from the symptoms also. So what can be the symptoms? See, for gastric ulcer, there will be acute sharp pain, and pain will be in the epigastric region. In the epigastric region, the patient will feel pain, and but the pain pattern will be food pain pattern. Means when the patient will eat something, they will have pain. Means when food is goes inside the stomach, that food can irritate the mucosa membrane if there is ulcer, and that can cause the pain. So patient will have pain after food, okay, and there will be no night pain. Only they have pain after eating. So they generally try to avoid food, okay, and vomiting is common. And with vomiting, hematoemesis means with vomiting there can be blood can come out. So in gastric ulcer, there is pain after food. After meal, they will have pain, and there is no pain in the night. Okay, and hematemesis is common, and loss of weight is common because they have pain after food. So they try to avoid food. So they eat less. Okay, so in chronic gastric ulcer patient, weight loss is possible. Okay. Patients generally choose bland diet. They avoid fried food, spicy foods, hot foods. They have pain aggravated because of spicy food. If they take too much hot, too much cold, then it can aggravate the pain. So they try to avoid it. There will be deep tenderness in the midline of epigastrium. If you press the epigastric area, patient will have pain. Okay, there is no seasonal variation, and this is common in the labor class because they avoid the food at the regular meal. They avoid the food pattern. They don't follow the right food pattern, and because of long gap in the food, the acid secretion can damage the mucous membrane. So in the labor class, or anybody, even doctors suffers from this kind of problem. And because they have to do long surgeries and without food, so doctors also suffer this kind of problems. Not laboring group, anybody who skip meals and stay in the empty stomach for a long time, they can suffer from this kind of disease. Okay, and even I suffered from this problem when I was in medical college. When we go to OPD and when we finish our OPD, there was it was more almost 3 4 like that. Without food, we eat to work. Then I also suffered this kind of problems. So this is very common nowadays because of wrong lifestyle. And ulcers can be simple, soft edges, and this all findings you will get in the endoscopy report. In the last video also I discussed about the pathological changes. So based on that we can work, but generally it is the dryness stage, dryness disease because of the sharp pain. Okay, and stenosis also appear, belching of bad smell also possible. So if you are getting bad smell, that means it is going towards the coldness stage. And in endoscopy we can understand whether it is superficial ulcer or going into the deep ulcer. And if going to the deep, then we can understand it, the disease going from dryness stage to the coldness stage. Okay, and duodenal ulcer, in the this is common cause is the hypersecretion of acid, and that acid can aggravate the disturb the mucous membrane of the duodenum, and sometimes it is associated with alcoholic cirrhosis and tobacco and hyperparathyroid. And main is the acidity, stress also, because in stress the acidity can be increased, and this increased acidity can disturb the mucosa membrane. Okay, and it is common in the first part of the duodenum, and size can vary. Okay, but main important point for us is the clinical feature. So clinical feature is there is pain food relief pattern. In gastric ulcer, there was pain was aggravated after food, but here they will have pain in the empty stomach, and whenever they used to eat something, they get the pain got uh, reduced. Okay, and they generally have night pain. We see after having a dinner, when they go for bed after 3 4 hours in the midnight, say around 1 or 2 or after 12, they wake up because of pain. And in the night, if they eat some biscuits, snacks, anything, the pain reduces, then they go to the bed again. So through this we can diagnose whether the patient's pain is increasing after food or it is decreasing after food. If the pain is increasing after food, that means patient is having ulcer in the stomach. And if pain is decreasing after food, that means patient is having pain ulcer in the duodenum. Okay, and they have no vomiting in the duodenum, they will have no vomiting, and they have night pain. In the gastric ulcer, they will not have night pain. In the duodenal ulcer, they will have night pain. In gastric ulcer, they will have vomiting, because the ulcer in the stomach can cause the vomiting with blood. But in duodenum, they will have blood in the stool, so that can be melena. Melena is common than hematemesis. So hematemesis is coming if they are having blood in the vomiting, that means they are suffering from gastric ulcer. And if the blood is coming, not fresh blood, if fresh blood will come, then it will coming from the rectum area, the black stool, we can say. And if you go for the stool test, then also they can confirm that there was a blood in the stool. So if the dark stool, that means this is the melena, and this blood is coming from the internal side of the digestive tube, so it can be because of ulcer. Okay, and no loss of weight, because they can eat, and there is no particular choice, they can eat anything. And they have deep tenderness in the right hypochondric region. In the right side, they will have pain. In the gastric ulcer, they will have pain in the upper gastric region, upper epigastric region. Okay, and because of stress, those who are under stress, they will have this kind of problem. Then what treatment we have to use? Then if there is a problem in the, they have a problem in the stomach, then we have to sedate dryness in the stomach. And if they have problem in the small intestine, then we can sedate dryness in the F meridian, small intestine meridian. And if you want to include the lunar chakra, then for stomach ulcer, gastric ulcer, we have to include internal heat chakra. And for duodenum, we have to include internal hotness chakra through lunar system. Lunar system we are using for digestive tract. And what we have to do if the problem is both in the stomach and um, duodenum, if person is having problem in both, in the gastric part also and the duodenum part also, in that case we have to sedate dryness in the stomach, and thinking about sedating dryness not only in the stomach, sedating dryness in the whole digestive tube. Okay, because stomach meridian not only control stomach, the stomach meridian controls whole digestive tube also. So in that case we have to sedate dryness in the stomach also, again in, if the person is having in ulcer in the both parts. Okay, and gastric carcinoma is the cancer. So again, the cancer you will find in the last part, pyloric part, and it is the womb coldness. So for a cancer problem, generally we had to sedate coldness from the uh, internal heat chakra also. Or if it is clear from the endoscopy report whether the cancer is in which region, generally it will be in the coldness region. So from the coldness region, again we can read and we can sedate the coldness. And sometimes we can sedate our hotness in the stomach also if it is very fast growing, or can sedate our hotness in the coldness as a disease, we are renting a disease. And in the stomach we can sedate hotness. And along with this, generally this is the general discussion, that's why I'm not discussing it over here, that in 6 key we have discussed that first we have to do quantity treatment, then the quality treatment. So because quantity is hetero and quality is homo, so first we have to remove coldness from the constitution, then we have to move to the next part, as if we have to sedate coldness from the branch. Okay, this is the normal phenomenon for our treatment. So this always we have to follow, but here I am discussing only the pathological part, how we can, what should be the energy. Okay, and causes, etiology causes can be many things. It can mainly the diet is the main cause, and lifestyle is the main cause. Again, the emotion part, for if a cancer, then we can find out the what is the emotional reason. Generally the fear, we have to sedate. So as per the emotion, we have to add emotional treatment also from trigen point of view. And the through endoscopy we can understand, this is called early gastric carcinoma or late gastric carcinoma, depending on the findings in the mucosa membrane, and we can understand. But our treatment will not change, it will be on coldness, generally our coldness or womb coldness we can understand. And clinical features for cancer is generally weakness and anorexia, and unpleasant taste and body loss, weight loss of weight is very important. So, but it is confirmed through endoscopy and biopsy only. Okay, generally we have to sedate coldness. Okay, and cancer without pain, it is womb coldness. So these are the treatments we have to do in cancer patients. Now, these are few complications of generally post-operative diseases. Generally, in post-operative diseases, we find this dumping syndrome and late dumping syndrome. Okay, this is not very common. This is a rare disease, but since this was discussed by Dr. Violeta, so I am discussing again this disease. So, dumping syndrome, and the dumping syndrome, patient will have sweating and weakness after eating. Okay, and they have palpitation, tachycardia, abdominal pain, and because of fast emptying. This problem is because of fast emptying, and this the main problem is patient have to advise, they have to take small food, homo food, and small interval, and this is because of cross-link constitution. You can see R wind, R humidity, and R coldness. So we need to sedate R coldness and wind in the stomach meridian. Okay, and this is a hypoglycemia syndrome, late dumping syndrome. Hypoglycemia means they will have fall of sugar even after 2 and 3 hours of the meal also, because food is not going from stomach to the intestine. Okay, so they will have sugar level will fall in this kind of patients. Okay, even, and we have to sedate coldness from unified humidity. In this kind of patient, we have to sedate coldness from unified humidity. So this is the branch treatment on unit level. And see, this patient will confirm that even after meal, you will check the blood sugar level after pp sugar, they have less sugar even after taking the meal. So but this is confirmed through some testing. They will go through that, they will put the camera, and through that they can check whether after 2 hours of meal, or even with the food is still in the stomach or going to the intestine, or the generally is the best way is to check this is after having full meal, they check the sugar level. If sugar level is still low, that means this is the patient is suffering from late dumping syndrome. Generally, this is a complication of surgery, post surgery. Okay, so if you find this kind of patient, you can do this kind of treatment, so you'll get wonderful results. Now, in the next video, I will discuss about the disease of intestine, and in that, generally, we will discuss the difference between Crohn's disease and ulcerative colitis. How can we distinguish the Crohn's disease and ulcerative colitis, and some other diseases also, indigestion, dyspepsia, and all we will discuss. Okay. So if you have any doubt, you can ask me. Okay. Smile. Thanks.